treating Cincinnati's violence as if it were a disease. That is the recommendation to City Council as a way to curb this growing epidemic.
Our Scott Wagner tells us how the city is really the patient in need of care.
Might need to pull up one more chair.
It was a small group with a big idea about Cincinnati's epidemic of violence.
It treats violence as a disease.
The Violence Prevention Working Group suggests that Cincinnati is a patient fighting an infection.
And when you see that emerge, you want to treat it.
Group co-chair Yvette Simpson says first there's the exposure.
Kids hearing gunshots, and then a kid witnessing a shooting, a kid being exposed to a violent interaction at school or at home.
The infection grows.
Those are all things that are building up in that child.
And eventually,
you'll have a full-blown outbreak of a disease, meaning that kid picks up a gun and shoots somebody.
How to treat it? Like a disease.
Reduce the risk factors, which is the exposures.
They want to identify children who are being exposed to violence in their neighborhoods and intervene with social services or counseling when possible.
And you increase your protective factors, which is like your vaccinations.
Group leader Mary Adams.
There's positive, fun, engaging activities in community that present an alternative to violence.
Cincinnati police say violence historically happens in clusters in areas as small as 400 feet across. The group hopes that with preventative care, having to perform surgery to remove the disease will someday become the treatment of last resort.
We know that if we do that 10 years from now, we'll see fewer individuals who are exposed to this and less violence, or what we call more peace.
Scott Wagner, 9 on your side, Cincinnati.